Hi, this is your Houston chiropractor, Dr. Gregory Johnson, and we have a very special case here today with Lilia. She is a Houstonian, and she hasn't been able to move very well for the past, how long?
4 years.
4 years. She's got multiple cervical herniated disc, thoracic herniated disc, and lumbar herniated disc. And I just looked at her MRIs, and her lumbar spine is actually kyphotic rather than lordotic, which is very, very unusual. And you can see how she's bent forward and over to the left, and that's to protect your pain, right? Your spinning muscle spasm.
Right.
And you have a hard time even sleeping, and it makes you really anxiety-ridden and nervous all the time, right?
Right.
It's invoking her fight or flight sympathetic response in the autonomic nervous system. So she's had chiropractic care previously and gotten twisted on her side. She said that made her worse. And she's had, what, you said 4 epidural steroid injections? That helped temporarily, but then now the pain's come back with a vengeance, huh?
Correct.
Okay. And you sought me because of watching our videos?
Yes, and a friend recommended me.
And so a friend recommended you as well? Good. Okay, Lilia, I'm going to have you just close your eyes. I know it's hard for you to stand there. I won't get you. Okay, bend your head forward and backwards for me, please. And then neutral. Okay, now you can see her whole posture is way forward. You see how her head's about 2 inches forward? See, look here, your ear's dropping all the way out here over your clavicle. It should be back here over your shoulders, but your shoulders are about 5 inches forward of your thoracic spine, which is putting all that stress in here too, which goes all the way down there to your low back and your pelvis. Okay, so I'm going to have you go ahead and lay on your stomach here for me, please. Now, Lilia is probably one of the most severe patients that I have seen in the last couple days.
Oh my God.
We've had some really severe patients in here in the past week, but in the past couple of days, I think Lilia gets the prize for the worst. So we're going to see if we can make you the best of the worst. How's that? Left leg is shorter by 1/2 inch here. And then see when I bring your legs up, look how it gets longer by 1/2 inch. That tightens up in your low back and your thighs and hurts, doesn't it? And she's got bilateral SI joint subluxations, and she's got her sacrum's completely posterior. And you can see here, she has absolutely no lumbar lordosis whatsoever. Her curve is completely reversing and flattened out here due to splinting muscle spasm due to those multiple herniated lumbar discs. Now just palpating from L5 all the way up here, every one of those are sore and painful, aren't they? All the way up into here.
Right.
And that goes around into your chest probably. And just tight shoulders on you all the time. Your neck's out right there big time.
Oh, yeah.
And right there's where your severe headaches are coming from. Now I tried to do a sacral deviation test on her and tried to get her to lift her right leg up, and she can't even perform that, right? Can you do this one at all? Tiny bit on the left, but her sacrum is posterior on both sides, so I'm going to perform my Johnson chiropractic technique on her, which is why you're here, right?
Yes.
So I am going to adjust her exactly the same way I would adjust any patient that has a herniated disc and sacral pain. I told her she could scream as loud as she wanted to. Now these are all going to be a little sore at first, honey, because they're already out of place. Just keep breathing. Did you feel that move? That moved good. There's your SI joint. I'm sorry. I'm sorry. Okay, keep breathing. There you go. Okay, keep breathing. I got you. Yes, ma'am. I know you felt that one. Look there. That was good too. That was L4. I'll get that curve back in there. There you go. Okay, keep breathing. I'm sorry. I'm not trying to beat you up, I promise. Look at there. You might be hating me right now, but your spine will be loving me in about an hour. Okay, look at her legs are even already. Now tell me if this hurts as much as the last time we did it.
No.
Imagine that.
My hands are numb.
That's okay. Just let your head relax there for a second. Yeah, I expected you to scream. There's no doubt about that. See, I got you breaking a sweat. That means I got your autonomic nervous system functioning better. Good. Okay. Let's slowly turn on your back for me now, hon. We're just getting started, too.
Oh my God.
I'll make sure you don't fall off.
Okay.
Haven't lost patient on the floor yet. I won't start with you.
Oh, I'm sweating.
Yeah, that's all right.
My hands are numb.
That's all right. Was that easier to turn, though? It looked to me like it was.
It was.
Yep. Okay, I'm gonna bring your head, slide down this way just a tad. There we go. I'm gonna be putting everything in your spine back into a better biomechanical position on the x-axis, the y-axis, and the z-axis, okay? So put your arms straight out to the sides for me. Palms up. Slide down this way a little bit more even. About another inch. There you go. That's it. I'm gonna adjust your clavicles here, your anterior ribs right here. I know these are sore, but you'll feel better if it's hurting. Okay, just relax. Let me have your right leg. Let this just go in my hand now. I got you. I know it hurts. I'm sorry. Breathe. There you go. Yep. Yep. You should have felt that from your knee all the way up to your lower back, though. Breathe. There you go. Good girl. Okay. Good. Okay, so let's have you sit up, face that way now. I'm gonna get you a towel here in a minute, huh?
Oh, wait, I feel really lighthearted.
That's all right. Some blood rushing to your head. Just breathe in through your nose, out through your mouth. Open your eyes, don't cover your eyes. You want your eyes open. Okay?
I'm lightheaded.
That's okay. You haven't had your nervous system working right in years.
In years.
So this is the first time your nervous system's getting a total reset.
Yes.
Because I am going to do a total reset on you today.
Okay.
There we go, through your right shoulder. You didn't think you had any pops left, did you?
Right.
There's your left one. We'll have to keep people abreast of your progress because, I mean, they see how severe you are.
Right.
If you were to tell our YouTube fans on a 0 to 10 scale how severe you consider yourself, where would you put yourself?
Before I got here, 10.
Yeah.
I was at the ER.
Yeah. You've
Like
been to the
3
hospital
times.
a few times, right?
Yes, because I couldn't tolerate the pain.
And what have they done for you?
Morphine.
Yeah.
Steroids.
Morphine, steroids.
Yes.
That didn't fix anything, did it?
No, not at all.
Okay, hon. Let's come over here on this table now. Drugs only hide the symptoms. They're not really fixing the cause of the problem. Butt here, head up this way.
My butt here.
Yeah, butt here, head up this way. Now she asked me if I thought she needed to have surgery, and I told her not at this point. Go ahead and lay down on your back for me with your butt on this pad down here.
Oh, I feel like I can't.
A little bit more. Down this way. There you go. Okay. She has not lost control of her bladder or bowel function, so that's the main reason I would ever refer anybody to have spine surgery. Other than that, you want to try every conservative means possible to you. I know this feels tight, but I want you in there tight. I want you to get away on this one. Just let your legs relax and bend naturally. This actually should make your back feel better with your legs up like this. Does that feel easier on your back?
A little bit, yeah.
With the exception of these tight pins? Yep. Okay, just relax your head. There you go. Okay, now, breathe through your nose for me, hon. Exhale. Let me have you. Oh, yeah.
Oh my God! God!
Yep.
It hurts!
Okay, keep breathing. Breathe through your nose and out
Oh
your
my
mouth.
God, I can't!
Yeah, you can. Keep breathing. Here, squeeze my hand. There you go. I told you I was going to do a total reset on you. I just decompressed your whole spine, took that pressure off those discs. That'll help suck the nucleus back up inside your disc. There you go. That's it. Just keep breathing. I know that was going to be painful. I knew that ahead of time. Here, just keep squeezing my hand here. Looky there, though. You got reflexes. That's a good thing. You breathing better? I know that hurt like the dickens, didn't it?
Yes.
It's one of those hurt so good treatments, so. Like I said, you'll hate me now, but you'll love me a little bit later on. Okay. Yeah, just relax right there for me, hon. Let me have your nap. Yeah, I got you. I'm not gonna rip your head off. There you
Oh
go.
my God.
Yep, let me do it. Well, you left big toe. Look at that.
Oh my God.
Yes, ma'am.
Am I almost done?
No, you didn't almost die.
I said, am I almost done?
Oh, yeah. Yeah. And he said, I almost died. No. Yeah, you're almost done. I still gotta shoot you, though. Here, let's set you up here.
Oh my God. That was terrible.
You're a Houstonian. You're used to that shooting, right?
Right.
Okay, here, let me help you
I'm
up
a
then.
little lightheaded.
That's all right. I'll help you. Okay? Keep breathing. Deep through your nose, out through your mouth. There you go. Keep breathing. Keep your eyes open, too.
I'm sweaty.
That's all right. That's an autonomic nervous system working. That's the way it's supposed to be. I'm right here with you. I'm not going anywhere.
Am I gonna pass out after this?
No. If you were going to pass out, it would have been during this ring dinger.
Okay.
Here, let's come over here in front of the mirror slowly again.
What is the shoot? What does it hurt?
What does what now?
What does the shooting do? Does it hurt?
No, I'm going to adjust your atlas and retrain your brain how to hold you in a better position.
Okay.
So look at you're standing up straighter already.
Yes.
Does she look straighter to you?
Yes.
Yep. Okay, hon, close your eyes again and bend your head forward and backwards for me. Okay, this is what this feels like. That's a little tap, see? Okay, so here's what I want you to do. I want you to roll your shoulders up and back. Okay, now hold those there. I want you to flare your hands way back like that.
I can't feel my hand.
Okay, now we're going to bring your head straight back here over your spine.
Okay.
Now I want you to look at the wall behind you. I know that's going to be hard for you to do right now. You're going to feel a little tap right there. Okay, hold that position. Another little tap right there. Okay, now relax. Okay, now let's have you flex your head forward and backwards again. You tell me if this feels any smoother than the previous two that you just did.
Yes, it does.
Feels like I put a little WD-40 in there?
I feel like I'm floating.
Yep, good.
Yeah.
Walk around just a second and tell me how your back pain feels right now compared to when you walked in the door. Better, isn't it?
Yes, better.
Yeah.
It feels better.
Yeah. You still got a hitch in your get along, but you're getting around better than you were when you first saw you.
Right, yes.
You couldn't even sit down out there in the reception area.
No, I couldn't.
Yeah.
It feels better.
Now, let me just share with you, this may get worse before it gets better, meaning that you know how it feels to go to the gym for the first time, you hadn't been in a long time, you get really sore?
Yes.
You're going to be really sore. When you get home, I want you to put crushed ice in a freezer baggie directly on your skin over whatever's hurting, whether that's your back, your mid-back, or your neck, for 20 minutes only. Not these gel packs that you throw in and out of the freezer, but crushed ice in a freezer baggie right on the skin for 20 minutes, no longer than
Can
20
I
minutes.
do several at the same time?
You
for
can
20
do
minutes?
separate areas
At the same
simultaneously,
time?
yes ma'am.
For 20 minutes?
You can do your neck and your low back simultaneously.
Okay.
And I want you to try to lay on the floor tonight with your legs up on the couch or on an ottoman or
Okay.
a footstool or something and have your legs propped up. That'll help us with this lumbar spine and your herniated disc and the sciatica that you're having in both legs. So, what would you share with our YouTube fans around the world about your very first experience here at Advanced Chiropractic Relief?
It feels better.
Did I examine you thoroughly?
Yes.
Did I do a thorough case history on you?
Yes, he explained everything correctly, my MRIs, and he helped me out a lot.
Well, thank you.
I
I
feel
look forward to helping you get well.
better. Thank you.
That's what we do here. I like the severe cases. I like a challenge.
Okay, thank you.
This is your Houston chiropractor coming to you from Advanced Chiropractic Relief in Houston, Texas, where we practice hardcore chiropractic on the most difficult cases of spine-related issues in the world. We'll see y'all soon.